Let me paint you a picture. You are 74 years old. You feel incredible. You are sleeping well, your energy is strong, and you are actively doing the things you love. You go in for your annual physical. It is routine. Nothing is wrong. But your doctor glances at your chart and says, "You know what? Let's run a few extra tests today, just to be safe." 6 weeks later, you are sitting in a surgeon's office. Not because you felt sick, but because those just-to-be-safe tests found something. And that something set off a catastrophic chain of events that your 74-year-old body was not equipped to handle. Now, the life you were quietly enjoying looks very, very different. That exact story plays out more often than the medical system ever wants to admit. Welcome to the Men's Wellness Blueprint. Today, we are having a serious, unfiltered conversation about the reality of modern medicine. We are going to expose the hard truth that most doctors simply will not say out loud during a 15-minute appointment. After the age of 70, some of the most common routine medical tests can cause dramatically more harm than good. Not because medicine is evil, but because the risk-to-benefit math completely shifts as you age. And nobody is doing that math in the room with you. Today, we are breaking down the blueprint. I am walking you through 5 specific medical checkups that every man should seriously reconsider after the age of 70. I will tell you why the math changes, what actually happens to patients, and the exact questions you need to ask to take control of your next doctor's appointment. Stay with me through all 5 because number 3 has shocked countless men, and number 5 is something most guys never hear about until it is too late. Before we dive into the 5 checkups, you need to understand one absolute rule. I call it the longevity lens. When you are 50, aggressive screening works beautifully. You find a problem, you treat it, and you buy yourself 30 more years of aggressive living. But after 70, 3 distinct things change. First, many conditions found by routine screening will never actually harm you. They grow so slowly that you will likely outlive them. But once a doctor sees it on a report, they do not have a leave it alone button. They have a treatment button. Second, your body's tolerance for intervention drops. A surgery that a 55-year-old bounces back from can completely destroy the independence of a 78-year-old. Third, the cascade effect. One test finds a small abnormality. That triggers a scan. The scan triggers a biopsy. The biopsy triggers a procedure. The procedure causes a severe complication. Suddenly, a perfectly healthy man is navigating a medical nightmare, entirely caused by a test he did not even need. Keep that longevity lens in mind. Checkup number 1. Routine colonoscopy after age 75. Consider a man named Arthur. 77 years old, sharp, and totally symptom-free. He had clean scopes in his 50s and 60s, but his doctor said he was due for another one. Arthur drank the brutal liquid prep the night before. It hit his aging kidneys incredibly hard. By the next morning, he was severely dehydrated. His electrolytes crashed, and his heart was at risk. He spent 4 days in the hospital and never even got the colonoscopy. He did not need it. The U.S. Preventive Services Task Force explicitly recommends against routine colonoscopy screening for average-risk adults over 75. After 75, the risk of a bowel perforation, a literal tear in your colon, significantly increases. Meanwhile, the colon cancers most likely to be found in asymptomatic older men grow so slowly they would never cause a problem. If you have no symptoms, ask your doctor about a non-invasive stool test instead. Do not blindly accept the risk. Checkup number 2. Aggressive PSA prostate testing for low-risk men. Let me be precise. Cancer screening saves lives. But after 75, aggressive screening in average-risk men has a massive overdiagnosis problem. Modern imaging is so sensitive it detects microscopic, slow-growing tumors that would never spread and never shorten your life. But the moment the word malignancy hits the report, the machine turns on. Biopsies, radiation, surgery. Men who felt perfectly fine undergo treatment and are left with chronic fatigue, severe urinary problems, and a destroyed quality of life. They traded their independence to fight a cancer they would have died with, not from. If you have no symptoms, ask your doctor. If we find something, what are the realistic treatment options at my age? That question changes everything. Checkup number 3. Routine cardiac stress testing without symptoms. This sounds incredibly logical. Your doctor says, let's make sure your heart is doing okay. You get on a treadmill. But here is the brutal reality. In asymptomatic people, these tests have a false positive rate that can reach 40%. That means almost half the time, the test flags a problem that does not exist. That false alarm launches you into a cardiac catheterization, a serious procedure with risks of bleeding, vessel damage, or triggering an actual heart attack. And if they find a partial blockage, which is extremely common in older men with no symptoms, they might put in a stent. Massive clinical trials have proven that stenting stable coronary disease does not reduce heart attacks or extend your life any more than medication and lifestyle management. But it does carry surgical risk and a lifetime of blood thinners. Instead of risky tests, optimize your actual risk factors: heavy exercise, proper sleep, and strict diet. Checkup number 4. Routine bone density DEXA scans leading to automatic medication. Osteoporosis is real, but the automatic pipeline following a DEXA scan is dangerous. Your doctor sees low bone density and prescribes a bisphosphonate medication. You take it for years, assuming you are protected. What they do not tell you is that long-term use of these drugs is linked to spontaneous stress fractures in the thigh bone, the exact bone you are trying to protect. They are also linked to severe bone deterioration in the jaw. Meanwhile, the most effective intervention for preventing fractures is not a pill. It is physical balance training, removing tripping hazards, and optimizing protein and vitamin D. A routine scan leading to automatic medication for an active, healthy man is a conversation worth having, not a foregone conclusion. Checkup number 5. Asymptomatic carotid artery ultrasound screening. This is the one nobody talks about. An ultrasound checks the blood vessels in your neck. If they find a blockage, they surgically clean it out to reduce stroke risk. The reality? The surgical procedure carries a 2 to 3% risk of actually causing a stroke during the operation. The Preventive Services Task Force explicitly recommends against routine screening if you have no symptoms. Why? Because many men over 70 have stable, silent narrowing in their arteries. When you screen for it, a well-meaning surgeon operates. The surgery itself dislodges a piece of plaque, sends it to the brain, and triggers a massive stroke. If you have no neurological symptoms, control your blood pressure and stay active. Do not go looking for trouble. Here is the blueprint. Every time a doctor recommends a screening test, ask these 5 questions. Question 1. What is the false positive rate of this test for a man my age? Question 2. If this test finds something, what are the realistic treatment options for someone my age? Question 3. What is the exact procedural risk of any treatment we would likely pursue? Question 4. What happens if we just monitor this instead of treating it aggressively? Question 5. What is the most effective lifestyle intervention for this condition? Any good doctor will respect you for asking these questions. If they dismiss you, find a new doctor. After 70, the goal of your healthcare is not to generate findings. The goal is to protect your independence, your energy, and your absolute physical freedom. You deserve a healthcare system built around your life, not around a checklist. If this video armed you with the knowledge you need, hit that subscribe button right now. We are building a brotherhood of men who refuse to blindly follow the system. We drop elite-level, science-backed strategies every single week to keep you operating at your absolute peak. Go down to the comments and tell me, have you ever had a routine test that led to a nightmare scenario? Tell your story. Your comment could save another man's life. Share this video, take control of your health, keep building your blueprint, and I will see you in the next video.